Good afternoon and welcome to another Supreme Fertility Live. I'm joined this afternoon by Tanya Albert, a dietitian and one of the founding members of the Transform Your Health Network, which is a network of dietitians and counselors all over Gauteng and online. So I'm super excited to be chatting to Tanya this afternoon, and we're going to be discussing the basics of nutrition for fertility. So Tanya, welcome and thank you for joining us this afternoon.
Thank you so much for having me.
Before we get started, can you maybe just give us a little bit of a background, bit of basics in what is infertility or what is fertility that patients can watch out for?
So, Deborah, I'm going to talk today about nutrition, and obviously we're going to touch on fertility as well. And just to take us back to basics, nutrition is about eating food, and it gives your body what it basically needs to stay healthy and to work properly. I mean, to focus and to function all day long. And the main nutrients your body needs that we need to consume are macronutrients like proteins, carbohydrates, healthy fats, and then we also have our micronutrients like our vitamins and our minerals. And these nutrients all play an important role just for our bodies to function, and an even more important role in fertility. And to answer your first question about infertility, according to a study that was done in 2018 in the US, infertility is basically defined as the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. And I don't know if you knew this, but according to this study that was done in 2018, it affects 15 to 25% of couples in our Western countries. And with this increase in cost that we also have for infertility treatment, research has been looking into, what are the alternatives that we can use to measure and assist with fertility among couples that are struggling.
And that's a bit what you're going to be sharing with us today. You're going to be touching a bit on lifestyle and nutrition as well that can assist with that.
That is absolutely correct. That is what I'm going to look at. And we need to remember that when we look at nutrition, we are what we eat, and it holds a key towards, healthy living and looking great, feeling great, and what we put in our mouths and how it reacts in our bodies actually influence the outcome of our health. But very few couples know how strongly nutrition actually has an influence on fertility and also having healthy full-term pregnancy, the impact nutrition would have on that. And we don't always have control over our genetic makeup or how we are born, what we are born with. But what we do have control over is our lifestyle choices and the food choices we make, and how these food choices and lifestyle choices can actually impact our genetic outcome. And good nutrition and a healthy body weight for both partners can have a significant impact on the ability to successfully conceive.
And Tanya, I know a lot of the time as well, the focus lies with the woman and what she must eat and what supplements she must take and dietary changes. But what about the man? Is it as important for him to focus on these things as well?
Deborah, that is a very good question. And as females, we know the burden's always put on us to carry the baby for 9 months. But, it takes 2 to make a baby. And the male fertility is very important because studies have actually revealed that males who are obese and have poor dietary food choices, it can affect their hormonal health, it can affect their sperm count, and it can affect their sperm mobility, which all are important factors when it comes to fertility.
So what I want to share today is just to pick your brain a little bit. I know we've got a lot of couples listening in, and if they do want to increase their chances of falling pregnant naturally, what particular dietary and lifestyle interventions and changes would you recommend from your point of view and from a dietetic point of view as well?
So number one that I would definitely recommend is we need to look at the weight issue. So a healthy weight is definitely the first step, and achieving and maintaining a healthy weight will increase your chances of conceiving successfully. And studies have showed that over and over again, that being overweight or obese can alter hormonal levels and can affect the ovulation cycle.
Now, Tanya, is it only overweight and obese couples that are going to have trouble falling pregnant?
No, Deborah, when we're looking at weight, we're looking at both sides of the coin, because if you are underweight, you actually do affect your hormones as well, or you can affect your hormones. Menstruation cycles can stop, and even your ovulation cycle can also stop if you are underweight. So having a healthy weight is definitely important.
Tanya, just what I wanted to ask you as well, for our audience listening out there, a lot of them might have weight issues, and I know that could potentially be one of the reasons they're struggling to fall pregnant, etc. But what advice would you suggest for people that are struggling with this excess weight when it comes to falling pregnant?
Well, Deborah, if the listeners are ready to go on a journey to achieve and maintain a healthy weight, first step is avoid going on any crash or fad diets, because they can actually deplete your body from the essential nutrients it needs to help with successfully conceive, as well as the nutrients your body needs to carry a successful pregnancy. Rather follow a healthy eating plan that works for you, and you can bring it into your lifestyle. So if you are an endurance athlete, or if you are a stay-at-home mom, your eating habits will be different, your time management will be different, and your lifestyle plans need to fit in with your life, because 90% of diets will fail. That's what studies have shown. So you need to bring it back to basics and start changing those habits. And you can definitely speak to your nearest dietitian, because remember, dietitians are experts on nutrition, and we're very good at planning individualized meal plans that is best suited for a person's lifestyle, their habits, their chronic disease, their age, and their gender. And they can help you to plan and to support you and guide you to develop those healthy eating habits.
Tanya, I know you highlighted and you emphasized nothing fad, crash diets, cutting your calories, restricting severely, etc. like that. But are there any particular kinds of foods or nutritional things that you would recommend couples avoiding, or for that matter, that they need to include on a daily basis to help improve their chances of having a baby?
Good question, Deborah. And I want to start with the ones that you should avoid. And I hope our listeners have got a pen and paper ready. I'm going to go through a few of them. And number one is stress. I mean, stress is something that affects all of us. And it's something that some people manage very well and some people not so well. But inside our bodies, stress can cause a lot of havoc. It can affect our insulin levels. It can affect our hormonal levels. So stress management is definitely step one. And there's various things that you can do. I mean, it's not my scope to talk about how to do stress management, but if you look at some of the techniques that are there, you can look at journaling, you can look at seeing a counselor, exercising, breathing exercises. So people need to find what works for them to manage their stress, besides indulging into things that will be more harmful for their bodies, like alcohol, smoking, and drugs. Then another one we need to look at is our sleeping patterns. And this is all just basic lifestyle things. If our sleep, when we sleep, we actually release a hormone called melatonin. And melatonin is very important in healing our bodies. It also, I call it the little soldier that packs all the suitcases for the next day. And it packs all your cortisol for stress. It packs all your insulin. It packs all your estrogen, all your testosterone, so that everyone's ready for the next day to do what they need to do. And if we're not getting adequate sleep, we actually affect this melatonin to work effectively. And then there's like this ongoing process of hormones not being in place and enzymes not being secreted. And then again, if you're tired, I mean, your cravings are increased. So, and you're not going to eat broccoli when you're tired. You're going to go for something sweet or something fatty. Another tip that our listeners can look at is reducing the amount of red meat. I think as South Africans, we eat a lot of meat and we don't realize how much harm it can cause if you overconsume it. So the recommendation is to decrease it to 1 to 2 times a week if you are having red meat. And also looking at removing or limiting simple or refined carbohydrates. So those can include your sugary drinks. It can include your processed grains, including your white pastas, bread, and white rice. And then looking at some of the studies have actually had strong evidence looking at decreasing trans fats. So these are the things that make food taste great, and it's your margarines, your shortenings, and your fried foods. Normally you find them in your baked goods as well. And look, being mindful of what you are eating for the day, and looking at, do I really need to eat that extra croissant? Because it will be filled with some trans fats that you can decrease. What you can also look at, or what our viewers can look at avoiding or limiting, is our highly unhealthy processed food. So there's a difference between a healthy processed food and an unhealthy processed food. If there's lots of sugar, fats, colorants, preservatives, nitrates, and salt added to the food to either change its texture or its taste or its color so that consumers will have more of it, then it is considered as a highly processed food. And our bodies aren't capable of, well, our bodies can metabolize it, but it's not ideal, because where do all those artificial colorants go? Like, who's in charge of taking it out of your system? Then obviously alcohol, most people know this. Couples who are actively trying to fall pregnant need to look at their alcohol intake and abstain as much as they can, because it can affect hormonal health as well as sperm, like hormonal health for the male and the female. And then there were some studies talking a lot about caffeine, and if you have excessive amounts of caffeine, it can negatively influence your body. But there are, however, studies that show that having 1 to 2 cups of coffee actually is beneficial, but obviously not while you are pregnant, more during the conceiving process. If you have 1 or 2 coffees because you like coffee, then it's fine. But if you're having more than that, looking at how you can decrease the amount of caffeine that you have in your diet.
Sure, Tanya, you've given us a lot to chew on there, and I hope everybody was taking notes, but just to recap some of the important things like the stress reduction, too much alcohol, and even smoking for that matter, I think is another one that we could also mention there as well, and all the saturated and the heavy fats. And I think that's what's so nice about your Transform the Health Network that a lot of patients don't realize, is you do have the counselors and stuff on board as well that can look at their nutrition and help them get through those stressful periods. I think everybody does have a bit of stress on a daily basis, but I'm just learning how to manage it and making changes when there's nothing else that you can do about it. So all these things to avoid. I know everybody's going to seem extremely overwhelmed at this stage, and I don't want them to do that. So any tips of things that they should include? What can they eat more of, and what's going to be beneficial and help them be more reproductively healthy for both the men and the women?
Deborah, something that my clients I always teach them not to do is they always focus on the stuff that they shouldn't be doing. And then they walk into the office and they say, oh, Tanya, I've done this again. I don't know why I'm doing it. I know I shouldn't be doing it. Or I wish I could be doing this and I know I shouldn't be. We put so much pressure on what we shouldn't be doing, and we stop focusing on what we should do and what we should include. And some of the steps that our couples can follow to help them to reach that nutritional status, to help them with optimal fertility, can be to include monounsaturated fats. So those are your healthy fats. Those are your anti-inflammatory fats. You get them in foods like avocados and olive oil, and even in some supplementation as well, which I'll touch on a bit later. And some of the research around fertility have actually veered towards the Mediterranean diet, because it's a clean diet, it's high in fiber, and it's got all your monounsaturated fats in it. But again, diets are individually based, and there's not one diet that fits all. You need to look at your lifestyle, and you need to speak to your nearest dietitian who would help you to find the best suitable diet. Another step that our viewers can take is using less animal proteins. Earlier I mentioned about red meat. Rather focus more on your plant-based proteins, so including your soya, your legumes, your quinoa, your beans, and your nuts on a regular basis, at least once a week. Have your meat-free Mondays, if you want to call it, definitely at least once a week. Or maybe focus on having your lunches more plant-based, and then having your main meal with your family, which majority people have in the afternoon, or in the evening, they can then have their meat there. Focus on more high fiber, low glycemic, carbohydrate rich foods. So those would include your whole grains, your brown pastas, your brown rices, your fruits, your vegetables, and eating an antioxidant rich diet. And this is very important for male fertility. If you look at some of the research out there, they talk all about the antioxidants. And we find antioxidants in our fruits and our vegetables. Now remember, antioxidants are soldiers that fight in our body. They help to repair, they help to clean, and they just, you know, these monsters that work inside our bodies to protect us, build our immune systems. You find them also, besides fruits and vegetables, you can find them in nuts, in grains, and they are packed with, you know, your antioxidants are basically your vitamin C's, your vitamin E's, your zincs, your folates, your beta carotenes, your luteins. So, I mean, the list is endless. We can have a whole session about antioxidants one day. And as I said, it's very, very important for your males. Then looking at more exercise in your daily routine, like keeping it moving, because it helps to control your hormone levels. And not most of us are having sitting jobs. And now with most people working online, they're sitting even more, and they're forgetting to stand up every hour because, you know, you're not really going to the meetings. You're just sitting on your screen, watching your screen for meetings. So we need to make a conscious effort of being active and just keep on moving and putting that minimum amount in your day. So the WHO basically recommends 150 to 240 minutes of physical moderate intense exercise. So find what works for you and what you enjoy. And it doesn't always have to be alone. You can do it with, you know, you can play with the dog, you can play with the kids. You can just bring it into your daily life. And then something that resonates with me very closely is having your 3 main meals a day. A lot of people are trying different fad diets and skipping breakfast or skipping lunch because they're too busy, and then they overeat in their next meal. And when we do that, we actually affect our hormonal balances and how our enzymes are being released and how we are going to have cravings and our sleeping patterns. So focusing on having your 3 main meals and making them wholesome meals is very important, and don't skip breakfast.
Thanks, Tanya. Now, it's a bit of good news for the men as well, because I know all these healthy changes and avoiding all these things they like the coffees and the alcohol, etc. But the good news is for the men out there is they get off the hook. So they've really got no excuse, because as soon as the wife falls pregnant, they're sort of off the hooks. I think they also really have to pull their part for those 3 to 6 months until the job is successfully completed. You did mention supplementation. What about supplementation? What is your thoughts on supplementation?
So, Deborah, this is quite a hot topic, and a lot of clients ask me about it because there is so much information on the internet. There's so much people selling things. There's so many brands out there. Like, what should I be using? When you just walk down the pharmacy corridors, there's all these bright colors, and there's all these different types of calciums and different types of multivitamins. Which one should you be using? So I always tell my clients that having a balanced diet filled with a variety of nutrients is always number one and should be your first choice, because you can never overdose with food.
Yes.
You can't overdose with the nutrients in food. However, we are living in a very fast-paced time, and we don't always get our 5 a day. So, Deborah, if I had to ask you, do you get 5 fruits and vegetables in every day?
I haven't this week, but I do try. I actually aim for 7 to 9 because I know the importance and the value. And it's a lot more achievable than people might think, because if you break that down, 3 servings for breakfast, 3 for lunch, and 3 for dinner, and they don't have to be that large. I know a serving in my opinion, is more or less about a half a cup or so of your veggies, and so it's a lot easier to include than most people would think. So it's just changing your habits and changing your thinking patterns and just doing things a little bit differently. So it's including more of these good foods. And I always say a lot of people focus on excluding. So I'm not having the sugar, I'm not having the white bread, I'm not having the saturated fats, but often that's not the problem. And what I always like to remind them as well is sometimes it's not about what you're not having. Are you getting enough of these vegetables and fruits? Were you getting these essential nutrients and stuff from, which people often forget about? So they have to focus, as you say, getting the right quantities in. like on a daily
That's
basis.
very true. And sometimes we even struggle just to do the basic food shopping to make sure that those fresh fruits and vegetables are there, or even the food preparation. I mean, if you've got a deadline, the kids are crying, everyone's expecting you to cook, okay, let's just go for convenience food. It's just so much easier. And many of us do that. And the fact that your body needs to be at its optimal health that it possibly can be when you are trying to fall pregnant with your partner, you do sometimes need additional support in the form of a supplement. And also, depending on your age, depending on your activity level, those are all factors that will influence. If you are on specific chronic medications, if you have a chronic disease, those are all things that will influence your additional need that you have above the 5 a day. So this is where we do need to look on supplementation, but again, it is individually based, and it should be discussed with your healthcare practitioner to find the best supplementation regimen that will fit with your lifestyle. It's not just everyone should be using it, because not all of the different supplements out there have good qualities. Some of them you're going to waste your money if you don't buy good brands, and good brands are expensive, and you don't know all the brands, and you don't know what you need. So just taking a supplement for the sake of taking a supplement is not always the right way to do it. There are, however, definite recommendations that studies have shown and research has actually shown that helps with fertility that should be used. And I mean, a lot of people talk about this one. It's quite a hot one. It's called folic acid. Males and females need to have folic acid, and the best would be in a methylated form, so methylated folate, because it absorbs much better in your body. This is a basic B vitamin, a B9 vitamin, and it's very important to start taking it before you are pregnant, because it helps to prevent pregnancy complications, things like spinal bifida that can happen. And it's very important for females to have an extra amount on top of their diet. Yes, you get folate from green leafy vegetables and fortified cereals, but it might not be enough for your body, and therefore this would be a supplement to look at when you are looking at supplements. Another one that I would definitely recommend would be omega-3 for males and females. Just because, yes, if we follow a diet filled with monounsaturated fatty acids, we might not always be able to convert that into the active forms that our body needs for anti-inflammatory properties. But when you are using an omega-3, do look out for those mercury-free brands, just because obviously we don't, mercury is, if you're pregnant, you're very sensitive to those toxins, those metals, and you want to make sure that the products that you are using is free of mercury. And I'm sure, Deborah, I mean, you can say more about that. I think it's more in your field when you're speaking about omega-3s. And then the other supplement that you can look at is vitamin D. But the research has shown that if vitamin D is not necessary if the blood values are ideal. So you have to go to your medical practitioner. They need to write a blood form for you to test your vitamin D in your blood. And if the levels are low or not adequate, then you would supplement. It's not just one of those you take off the shelf. Iron is, again, also very important. And also, you don't just take it off the shelf. Again, you need to confirm that there's a need for an additional iron supplement by doing a blood test. And again, you need to visit your healthcare practitioner to do that. And interesting, I found a study that they did specifically for iron. So they took, it was about 18,500 nurses that they put on the study. All of them wanted to become pregnant. And they started giving them more iron-rich foods, but in the form of vegetables and not meat. So your non-heme ions. And it was in the forms of beans and lentils and spinach, fortified cereals, low grain-enriched rice, and your whole grains. And they added extra vitamin C to it, because remember, if it's a non-heme iron, it doesn't absorb as effectively as an iron that you get from meat. And they added extra vitamin C to it in the form of, obviously, like fruits, vegetables, citrus fruit, your bell peppers, your berries, to enhance the absorption. And they found that it actually lowered the risk of ovulatory infertility, which I thought was very, very interesting. But obviously more evidence is needed, and you need to confirm, more evidence is needed if you need to take iron as an off-the-shelf supplement, and rather speak to your healthcare professional before you supplement it. Then the last one that is very important, especially for males, is your antioxidants. And those are your basic vitamin E's, C's, zincs, vitamin A, which is very, very important in male fertility. And if you're not going to have 10 fruits and vegetables a day, then it's definitely recommended to look at an antioxidant if you are looking to conceive.
And just something else I want to highlight why it's so important working with your healthcare practitioner is people just think it's safe to use these vitamins and minerals for extended periods of time, and they forget about the risks. There are side effects, even with the male fertility and the antioxidant studies have shown that if you use it for longer than a certain period, it can actually have a detrimental effect to your reproductive health and to your sperm health, etc. So we could probably have another whole session on that sometime, Tanya, but I think we're probably running out of time this afternoon. So are there any final thoughts that you want to leave our listeners with, or anything you want to highlight and reinforce again?
Yes. So I want to just veer back to the things that we've discussed. Take the following steps and just try and take small steps at a time. Don't try and change everything, because we're only human and we have habitual habits that are in our lives, and just stopping a habit doesn't help. You need to exchange a bad habit for a good habit. So start by looking at the healthy weight initiative. Try and achieve a healthy weight and maintain a healthy weight. And if you're struggling on your own, reach out to a practitioner that would be able to help you. Be mindful of those limiters or avoiders in your diet. So be mindful of alcohol intake, be mindful of smoking, as you said, Deborah, be mindful of red meat, trans fats, be mindful of highly processed, unhealthy foods that is in your daily diet. And don't just avoid everything. Remember to include the essentials, include the whole grains, include the real food, include the monounsaturated fatty acids, and speak to your healthcare provider regarding an individualized supplementation regimen that is specifically for you. And as I said, we are all human, and changing habits is not an easy feat. But if you have the intention to change and you start talking about it, that you want to change and you're going to change, and you take one small step every day, you can help move into a healthy habit and move into your goal of optimal fertility with nutrition.
Absolutely. I just think you've got so much more to share. So I would love the patients to book a session with you and really take that initiative, because you do need support and somebody to hold your hand and walk the path with you. And it does work. You just have to, all they say is that if the plan works if you work the plan. I think that's a lot of problem. People have all these good intentions and they stick to it for 1 or 2 days and like fall off the wagon. Just to reinforce what people don't know as well, it takes 90 days to get healthy eggs and about 72 days for healthy sperms. That doesn't help bringing in all these new habits for 1 or 2 weeks, because the eggs and sperm can actually be damaged right before the woman ovulates. So Tanya, thank you so much for all your valuable expertise and time this afternoon. How can people reach you if they want to book this appointment? Where can they get hold of you?
So they can just go to our website, www.tyhn.co.za, and they can book on a Calendly link for either meeting one of our counselors or meeting one of our dietitians, just to meet us, to see who we are, and we can look at where you are at the moment with your goals and what you want to achieve, and then from there we can book you a consultation session.
Fantastic. No, thanks again, Tanya. And if anybody missed out, I will be sharing the links on our YouTube channel shortly. And they're also welcome to send a direct link to Supreme Fertility. We will put you in touch with Tanya as well. So thanks again for tuning in. I hope you learned a lot of valuable tips and techniques to improve your overall reproductive health. So thanks again, Tanya, for your time.
Pleasure. Thank you.